OK です。それではよろしくお願いいたします。
Hi. So, good morning or good afternoon or good evening for all participants. So today we have a lecture from Ministry of Agriculture. Dr. Terashima will provide us a lecture named Veterinary Services and Animal Health Control in Japan. And during today's lecture, Terashima-san will have how to say discussion time with participants. So please actively join the discussion. Is it okay with you? Let's get started. そしたら寺島先生お願いします。
Hi. Thank you for the introduction, Dr. Asakura. Nice to meet you, everyone. I am Miu Terashima. I'm from the Ministry of Agriculture and Forestry and Fisheries. Sorry, I'm a bit nervous, but it's my pleasure to give you a presentation on veterinary services and animal health control in Japan. I hope you could see my screen now. The presentation, is it okay with you, everyone?
Yes, is it okay?
Okay. Okay, great. Well, today I will give a presentation, but I believe some of you have more experiences than I have. So, just Dr. Asakura said, it will be great help if you could share not only questions but also your experiences with everyone. So I'm gonna get started. Okay. First, I will go through the animal health system in Japan and move on to the individual disease controls in Japan. This slide shows relevant stakeholders in animal health in Japan. The Ministry of Agriculture, Forestry and Fisheries, MAF for short, is a veterinary authority in Japan which provides basic policy and guidance on animal disease control measures. In Japan, there are two divisions serving as a veterinary authority. One is Animal Health Division, and by the way, I'm in the Animal Health Division, and it's in charge of domestic animal health controls and international animal health issues such as SPS and bilateral negotiations. The other division is Animal Product Safety Division. It's in charge of veterinary pharmaceuticals, feed safeties, and veterinary license and aquatic animal health. Also, animal quarantine services belongs to MAF, and well, just the name it says it's responsible for animal quarantine. Later, I will go into more details on animal quarantine services, and other stakeholders are National Veterinary Assay Laboratory. This is responsible for assuring quality, efficacy, and safety of veterinary medical products. And National Institute of Animal Health, or it's called NIAH, covers basic research on animal disease and diagnostics. And it plays a role as a national reference laboratory. And another important part is that prefectural governments are also responsible for animal disease control at local level. Each prefecture has several livestock hygiene service centers, which conducts disease surveillances and diagnosis, disease control measures in case of outbreaks, and supervising the farm on farm biosecurity. And this table summarize Japanese laws related to animal health, and I believe there's 7. Broadly speaking, MAF is responsible for animal health, while Ministry of Health, Labor and Welfare, short for MHLW, handles human health. And like MAF holds the laws for animal disease control, veterinary medicines, animal feed, and veterinary affairs. And MHLW holds food hygiene, including hygienic control of slaughterhouses. Also, animal welfare issues and wildlife management are under Ministry of Environment. These mainly 3 ministries controls animal health problems in Japan. Okay, and this is the outline of the Act of Domestic Animal Infectious Disease Control. This act stipulates responsibility of MAF, local veterinary authorities, and livestock owners. Livestock owners are primarily responsible for disease prevention and prevention of spread of infectious disease. When owners or private pets detect any signs of notifiable diseases, they are obligated to report immediately to the local veterinary authorities, like prefectures, veterinary authorities. Then local veterinary authority conducts tests to confirm disease while they report to MAF. So MAF knows before the disease is confirmed, but when the disease is even suspicious. And MAF is responsible for developing guidance for disease preparedness and containment and providing disease confirmation. Decisions of emergency vaccinations and compensations are also also MAF responsibility. Yeah, I think there's a lot of information in this slide. So if you have questions, don't hesitate to ask. And I will go on. This map shows locations of animal health related facilities, and it's kind of tiny, but the white dots are the location of prefectural livestock hygiene services centers. As you can see, several centers are located in one prefectures. So this enables close communication with livestock owners. And black dots are locations of prefectural diagnosis laboratory for specific confirmation. And the red dots, there are 4, and these are the location of National Institute of Animal Health, which I introduced as a national laboratory. And in case disease confirmation is needed, samples are sent to NIH to perform conformity testings. And returning to animal quarantine services, it's responsible for preventing transboundary infectious animal disease, TADS, from entering to Japan through seaports and airports. Headquarters is located here. It's near Tokyo, and as you could see, we have a lot of branches and sub-branches located at the main airport and seaports. Animal quarantine services is also responsible for export inspections. So the risk of introduction of TAS has been rising as the number of international travelers increase. Especially after COVID-19, we have a lot of travelers, and we have been strategically increasing the number of animal quarantine officers year by year. And since 2019, there's almost 60 officers increased. And animal quarantine service conducts various activities to prevent TAS to enter Japan. For international flights and cargoes, animals and animal products are subjected to border inspection at animal quarantine stations, refrigerated warehouses, and terminals. Inspections are also conducted at International Post Office. And in addition, items hand carried by travelers are important targets. So far, we have detected several animal products from which travelers try to bring in Japan that tested positive for ASF by PCR test. Furthermore, viral virus were detected from some of these items. And in airports, various of activities is conducted. Animal quarantine officers actively ask travelers whether they are carrying any prohibited items unaware. And here you can see quarantine detector dogs also play a very important role in detecting animal products in the passenger's luggage. Also, this photo shows the disinfection mat. These mats are placed at the airport and seaports to disinfect the soles of travelers' shoes. And posters and digital signages are displayed at airports. Okay. We also have several communication tools such like SNS. We have X, Twitters of animal quarantine services, and YouTube, and posters and leaflets. And also there are in multiple languages so that travelers who don't understand Japanese could also get information in their languages. And collaboration with airlines and travel agencies are also important and to disseminate relevant information and raise travelers' awareness. We also provide information about animal quarantine and prohibited items for importation in cooperation with embassies in Asian countries where usually travelers get information about overseas travels. And about quarantine detector dogs, they are trained to sniff out animal products and fruits in passengers' luggage. They are working at a baggage claiming area in the airport, and they notify handlers by sitting down in front of the luggage when they found suspicious. When they sit down, the animal quarantine officers take travelers to the inspection counter and check their luggage. Over 43% of the illegal importation cases were detected by them, the detector dogs, and the number of quarantine detector dogs we try to make more increase since like many people since more luggages and people come into Japan. Okay, and in response to elevated risk of entry of TAS, especially ASF, the Act of Domestic Animal Infectious Disease Control was amended to strengthen penalties. The penalties for bringing prohibited animal products are raised to 7,000 US dollars. For ease of understanding, I'm introducing the penalties in US dollars. 7,000 US dollars up to $20,000. And if travelers fail to declare meats or animal products and such items were found in their luggage, the items are confiscated and disposed. These incidents will be recorded in the database with the passport information, so you could track down the violator for like if he or she are doing several times or it's just accidents and it's just the first time. And a warning letter will be issued to the violator. There have been some arrested cases of travelers bringing animal products such as sausages into Japan. But this won't happen when it was the first time. Like if the violators ignores the warning letter several times, it could go on to arresting. And also in May this year, we have amended the Act once again to strengthen measures against prohibited imports. A key change is that the authority of animal quarantine officer has expanded. They can now conduct on-site inspection of domestic stores and confiscate illegally imported livestock which are sold domestically. Um, it sounds like normal, but previously in our law, the authority was limited to only border control. So they could not they couldn't do anything once the products entered the domestic market. So we couldn't like confiscate the illegal product even if we found it was sold in like a store in Japan. And with this amendment, but now with this amendment, they can now enforce regulation within Japan in domestic area. And by the way, there was a thing I thought was interesting. It's an example. This photo, um, it's just a method used to illegal imports, but these are the sausages, and sausages are packed together with this is a tobacco, and these are corn, like which have a strong smell. So they try to import it illegally through, but with the strong smelling item could like make the detector dogs couldn't catch the sausages, and this is done to so mask the smell and avoid detective by the dogs. I thought this was, well, not good, but interesting. Okay, to tackle global issues on animal health, I believe everyone believes international cooperation is critical. And in Japan, we In Japan, several international frameworks have been activated both bilaterally and multilaterally. Also, strong collaboration with neighborhood country is important. For Japan, it's China and Korea. We have doing some framework with these countries, and in this slide, it illustrates what we have achieved, but I'm gonna skip the details. Okay, and while border control measures are important to prevent entry of animal diseases into Japan, on-farm biosecurity is essential in preventing entry of disease into the farm. So in Japan, biosecurity standards are to be complied with livestock owners, and it is stipulated in the Act of Domestic Animal Infectious Disease Control. This standards covers a basic concept of on-farm biosecurities, such as establishment of the biosecurity zone, disinfection of vehicles and equipment, and prevention of contact with wild animals, and heat treatment for feed originating from food waste. And these biosecurity standards, there are from each for the animals. This slide shows example for pigs. We also have biosecurity standards for cattle and poultry. And we also have it for horse. And on-farm biosecurity is essential in prevention of disease introduction and outbreak. In addition, we could say it is important ensuring safety in farm to fork concept because animal production is a very beginning of the food chain. Um, there are several steps to be taken by prefectures to ensure compliance with biosecurity standards at farms. Animal quarantine officers of prefectural government visit each of every farm in their authority at least once a year to check the compliance. If they find any incompliance to the biosecurity standards, they will provide a guidance. And if they still do not comply, eventually penalty will be subjected. Biosecurity standards are the minimum requirements to be achieved, and to achieve in advancedly, hygiene management based on HACCP approach. Specific guidelines named Farm HACCP has been developed in it's 2002, and certification system for Farm HACCP has started in 2011. It requires hazard identification, hazard analysis, identifying critical control points, and monitoring and recording and which ensures PDCA cycles in controlling hazard. And regarding the certification system, on-site inspection is required to publish certification. So it's not just document stuff. Okay, we are close to finishing up the system part. This is a table summarizing the occurrence of major animal infectious disease in Japan. Foot and mouth disease had an outbreak, which was at the southern part of Japan in 2020, Miyazaki. It resulted in culling of 300,000 pigs and cattle. Yeah, FMD was uh, when at that point, emergency vaccination was followed by stamping out policy was implicated, and we have Japan regained was FMD free status without vaccination in February of 2011. So occurrence of the next year. Okay, and yes, from next slide, I will move on to Japan's measures for individual diseases. So before that, I would like to take some time to know about each of your country's systems of animal health. So does anyone would like to share? You could just say this part was different from Japan, or like we do the same thing, blah blah blah, or something like that. And also questions about the presentation is welcome. And during the discussion part, I would like to get some help from the interpreter. So is anyone would like to start? Go first. It's anything could be okay. Okay, yeah, someone is raising the hand. Doctor, I'm not sure how to pronounce practical. You could just go ahead. Please put on your cameras on. Oh, hi, nice to meet you. Hi.
Hi. Yeah, I raise my hand, and I would like to share. I'm from Paraguay, so it's not a huge country, it's a small country. But regarding the animal, the cattle that you manage, we have a lot more. But in the slide you show all the process you do in math, and I think it's quite the same in my country. But regarding the airports, we don't have a lot of dogs, or we just have one airport because, as I said, Paraguay is small country, and we have another airport that is super small, and we don't receive a lot of how to say people travelers just in Paraguay. And I was wondering about biosecurity in your country, in, I don't know if correct to say, small farms or familiar farms. I don't know how to call it in English, but how do you manage to control the minimal measures that people need to have in these farms? Not only in cattle, maybe pigs or birds or other animals. That's my question, and my experience in Paraguay is like very difficult because, as I said, small farms are very difficult to manage since there are a lot of stuff that they don't have to control or to prevent disease getting through those animals that we cannot control. And yeah, and you can call me Patty, not Patricia, and so this it will be easier. Thank you.
Thank you, Party. Am I pronouncing okay? Party? Part. Thank you. Yeah, about the small family doing farms in Japan, the biosecurity standards are すいません。やっぱりI think I'm gonna go in Japanese. 小規模農場での、バイオセキュリティどうなっているかという質問だったんですけれども、この今紹介したバイオセキュリティスタンダードは、小規模であっても適用が必要と、いうものになっていて、なかなか、同じような課題は抱えているんですけれども、都道府県にある、先ほど言った、ライブストックハイジーンセンターが各都道府県に少なくとも1つ以上はあるので、そこを、そういったところとコミュニケーションを取ってもらって、そのような農場にも対応いただいている。このバイオセキュリティスタンダードは、小規模農場であったら免除されるというものではないですということを回答いただけますか。
So, Patty-san, your lecturer said that the biosecurity standards in Japan, this applies also to small farms. And so even small farms, they face same issues. So there are livestock hygiene service centers in Japan. In each prefecture, there are, like more than one. And so those, staffs belonging to the livestock hygiene service centers, they communicate with the farmers. 寺島さん。
はい。
Thank you.
はい。
Thank you.
彼女、の質問、最後のところの質問で、
はい。
どのようにして、先ほどそのバイオセキュリティを、はい、牛で、牛の
はい
疾病に対する対策ということでしたけれども、豚や鳥で、
はい。
どのようにして、対策をされているんでしょうかと、パラグアイの農家さんは小さい農家が多いんですけれども、やはり、病気が農場に入ってきてしまうのを防ぐのは、防ぐことが難しいんですが、という、はい、質問がございましたが。
そうですね。このバイオセキュリティスタンダードは、今、例として、豚が載ってるんですけども、牛とあと鳥にも、同様に、規定があって、それぞれで、農場の規模にかかわらず、遵守いただくという、ところになっています。これで大丈夫そうですかね。ちょっと一度そちらで回答お願いします。
Right. So, Patti-san, this slide shows the biosecurity standards in case of pigs, but also same applies to cattle, also to poultry. Yes, so regardless of the farm size, the same standards apply.
Okay, thank you. Thank you very much.
ありがとうございました。
寺島さん、1点だけちょっと補足で、年に1回は、家畜保健衛生所の職員が、農場に訪問して、こういったスタンダードが、守られているかっていうチェックするシステムがあるっていう点、補足させてもらってもいいでしょうか。
お願いします。
いいですか。ありがとうございます。Okay, so thank you for Patricia for your question. And I guess maybe last week Kirin-san presented explained about this, but at least once, once a year, Livestock Hygiene Service Center, the veterinary officer from Livestock Hygiene Service Center will be every year visit every farm and check whether the farmer follows these biosecurity standards. No matter how many livestock they keep, so even big farm or small farm, all farms, the veterinary officers visit all farms once a year to check the biosecurity standards is followed or not. That's a system.
Okay, all farms in Japan.
All.
That's
Yes.
A lot.
True. Yes.
Yeah. Okay. Thank you.
Thank you.
Okay, then anyone else would like to share their views or their experiences?
Agustin-san, could you share your situation? No?
Okay, then maybe more easily. As Japan being an island country, in the presentation we said we have a lot of animal quarantine services stations around the Japan's airport and seaports. Today, I believe today we have how do you say, not island countries. I'm not sure the phrase, but so if those, how do you control the country borders? Is it? I think it's more. Believe it's more difficult. It sounds more difficult, but anyone from like countries who doesn't have seas, just connected to the next neighborhood countries could share information or like how it goes at how do they do animal quarantine on the border. Could someone shares your experiences or how's that goes?
I can again share Paraguay, how we control import-export animals. So we don't have ocean, nothing. So we have Brazil, Argentina, and Bolivia, and we have port as well. And there are official veterinary there controlling all the products that comes and goes away. And if there are common animals, we have as well quarantine area, but in the airport we have a new just renew quarantine area, and in other part of the country we have as well extra points to control this import export, and this official veterinary performs this control, and we don't have specifically a quarantine area in that point. But for example, if cattle are coming, and so we have the destination already. So for example, it's in a farm, I don't know, wherever in the country, there are a quarantine area, just I don't know how to say it in English. I'm sorry, but we have quarantine area that are performed in, for example, just for those cattle to come, and there are people controlling and performing tests for these animals. Not only cattle, but for example, for pigs, there are another way to control, because we only bring the pigs from Brazil. So there is a cooperation from people that they have already performed the quarantine area in one department. Because you have a prefecture and we have a department here in Paraguay. So there is a specific department that are bringing pigs, so they are coming to this department in an area quarantine area to stay there, and private veterinary as well. They collaborate to check these animals with both together official and private veterinary, and this is the way we control this animal coming or going to other countries. And for products, we do the same as Japan does. Yeah, and that's my experience.
Thank you, Hardy. And can I have a question for you? You すいません。一点だけ質問があって、畜産物の通貨のやつは、通貨の検疫の拠点は常時開設ずっとステーションとしてある感じなのかがすいません。私聞き取れなくて、もしお分かりだったら、大西さんご回答いただいてもすいません。私がちょっとそこ聞き取れなくて分からなかったところで。
もうそのことは言ってなかったので、はい、聞いてみます。
ありがとうございます。
はい。So, Patti-san, so Ms. Terashima, she would like to know those quarantine areas where the livestock or animal products are checked or tested, quarantined. Are those areas always open?
No, I wanted to explain that, but I couldn't because this is my first time, like long time ago. I'm not talking in English, so sometimes the words I cannot. But I wanted to say that if when we receive animal importation certification, somebody wants to bring animals here, so there is a direction in Senaxa is our veterinary service name. So there is a place where you need to a certificate of these quarantine premises to be authorized or an approval from the veterinary service. So these animals can come there to do the quarantine. So there is a steps to do before the animal coming, because as I said, we don't have a lot of we don't have a specific as you show in this picture. We don't have a specific quarantine area for example, for cattle. For pig, I already explained that we have, but not for cattle or for other animals. So there is a step to approve an area for some animals to come there to stay there and perform test. So import, I think people need to do this process and to have a certificate of the place that animal will stay for some days to do this process.
Thank you. Yeah, it made it really clear. Thank you so much.
Yeah, it's kind of different since we don't have we are currently working on to have, since we have a lot of farms that are huge, and it depends on where it goes the animals. We need as well as you have some place in maybe in the entrance is difficult to have because we don't have a specifically area from the veterinary service to construct this area. So that's why we do these steps. Thank you.
Thank you. How's maybe anyone else? You could just same with Paraguay or different, or if yeah. Okay, then if it's okay, I would go on to disease control measures for individual diseases. Yeah, okay. I think I'm gonna go on, and please wait a moment. So, okay, I'm gonna go from, I will introduce Japan's measures for specific animal disease, and I will cover avian influenza and classical swine fever, foot and mouth disease, and lumpy skin diseases. And I will start with avian influenza. Okay, so in Japan, both high pathogenic and low pathogenic avian influenza in poultry are notifiable diseases. When poultry owners find any specific findings of HPAI or LPAI, such as increase in mortality, they are obligated to report to the professional veterinary authority. And in addition, avian influenza in poultry is closely associated with wild birds, especially birds move, fly, how do you say, migratory birds. So wild bird surveillances is routinely conducted by Ministry of Environment, which is responsible for wildlife. So, and information of positive results in wild birds and environment is immediately shared with MAF. And when a positive case was detected in wild birds or HPAI outbreak are reported in neighboring countries, MAF increased its vigilance. And when an AI outbreak occurs, stamping out policy is applied to ensure rapid containment. Japan's self-defense forces are sometimes deployed, and we also started to cooperate with private sectors to support the stamping out measures or disposal of carcass and disinfection activities. Okay, this slide illustrates the timeline from outbreak of the avian influenza to completion of control measures. First, as I said, professional veterinary authorities receive notification from the farms, the poultry farms. Then the suspected farm is inspected by the professional animal health inspectors, and clinical examinations, rapid tests, and genetic tests are carried out at prefectural levels. If the suspected case is confirmed to be positive for AI, response headquarters is immediately established in MAF. Also, movement restriction will be implemented, but I will go back to the restriction at the next slide. And at the affected farms, as soon as positive was confirmed, culling and disposal of carcass and disinfection measures will be carried out. Okay, yes, restriction zones are implemented after positive confirmation, and there are two types of zones. The 3-kilometer radius for movement restriction and 10 kilometers for shipment restriction. After establishing a restriction zone, farm inside the zone will be placed under the strict supervision by the prefectural government. And 10 to 17 days after stamping out is completed on the affected farm, prefectural government conduct a test on farms within the zone. And if all the tests indicate no infections, shipment, the 10 kilometers restriction zone will be lifted. And after that, if no suspicious cases is detected between 21 to 28 days after the completion of stamping out, the most smallest 3-kilometer restriction zone, which is movement restriction zone, will be lifted. Okay, I think that all of you agree with immediate response is essential for control of avian influenza. To ensure this, MAF and prefectural governments carry out emergency preparedness measures. They maintain stocks of materials which is required for control measures such as culling and disposal and disinfection. At government prefectures also have their stocks, and also in MAF, animal quarantine services have maintained stocks so that they could provide to the local governments if they didn't have enough. Okay, and I would like to move on to the foot and mouth disease control. Okay, as I mentioned, FMD occurred in Miyazaki Prefecture on April 2010. And actually, it was the first outbreak in 10 years. And stamping out on infected farms and movement control around the farms were implemented immediately. But as you can see, the graph, the infection gradually spreaded. Okay, and to contain the rapid spread in Miyazaki Prefecture, emergency vaccination was applied for the first time in Japan. And after that, we were able to contain the FMD, but in total, 87,000 animals were vaccinated by this vaccine and called. This map shows a vaccination zone. It was first it was at the southern area of Japan, and yes, these shows how it was spreaded. And the number of FMD cases decreased, and no further cases were reported after July of 2010. And total 292 farms are infected with FMD, and 210,000 animals were had to be culled. All the movement restrictions were lifted on July 27. The last case report was on July 4. and the movement restriction was lifted on July 27. And on the next year's February 2011, we have regained the status of FMD-free country. For this outbreak, genetic analysis of the isolated FMD virus was conducted. The virus was identified as type O, and the gene homology with the strain isolated in China was extremely high. So we believe that virus may have been introduced from FMD affected countries in Asia via people or goods movement. Also, in this case, FMD virus had spread to over 10 farms by the time when the first case was confirmed in 20th of April. Important points for controlling FMD were revealed from these experiences, and from that we have revised the act. And for outbreak prevention, we updated hygiene management standards by securing the land needed to bury infected animals. We also introduced preventive slaughter of livestock. In addition, MAF pays special compensations for animals infected with FMD, HPAI, and for other important disease in Japan. And we also created the rule for that those who don't take necessary measures, like not complying to the hygiene standards, biosecurity standards, for those who don't comply, they will get their compensation reduces or required to return them. This is not for like punishment. Well, it is for punishment, but it's the intent was not for punishment, but it was to like encourage them to do much more effort in the preventations, or even if they found a suspicious case, not to hide them, but or to just to immediately notify the local government, also to the MAF, so that we could achieve early warning, and we could act quickly to prevent the spread of the disease. And after the outbreak, we are free from FMD without vaccination country, and routine vaccination is prohibited, but we have vaccine stocks for emergency use, like about these doses. And as FMD is designated as a domestic animal infectious disease under the Act, it is a notifiable disease in Japan. Also, reporting system is same as HPAI. First, the farmers or the private vet found suspicious like symptoms, and they have to report that to the local government. And while the local government do the diagnostic tests, they have to inform MAF before, so that MAF and also local government knows that the disease when is still suspicious, not after the confirmation of the positive. And in particular, FMD has a very characteristic symptoms. So when a suspected case is reported, usually images from the field are also submitted to MAP along with the notification. And I will move on to the classical swine fever. And in September 2018, classical swine fever CSF was reported in domestic pigs for the first time in 26 years in Japan. The disease has gradually spread to neighborhood prefectures. And so far, 26 prefectures have been affected with 104 cases in domestic pigs. And yeah, I just miscounted when I submitted this slides to JICA. So maybe people have slide which it said 27, but 26 prefecture is correct. I'm sorry. Yeah. And yeah, this figures illustrates the trends in number of CSF outbreak in domestic pig farms. The first case was detected in Gifu Prefecture. It is located almost center of Japan, and then it spread to the neighborhood prefecture. And after a year, the disease spread further along with increase in positive cases in wild boar. Um, Preventive vaccination in designated area was implemented in October of 2019, and in the next year, January 2020, outbreak in domestic pig was detected in Okinawa Prefecture. And Okinawa Prefecture is an island far from mainland Japan. It is likely that the virus was introduced through human activity like people travel or some cargoes. And outbreak also occur where vaccination has been implemented. So highlighting the importance of compliance with biosecurity standards were clear. And this map shows where the CSF confirmed in prefectures. Red are both domestic pigs and wild boars, and oranges are only wild boars, yellows only for domestic pigs, and only Hokkaido prefecture, it's just above Aomori, is not, CSF is not confirmed both, so it's not in the map. And preventive vaccination in domestic pig was decided on September of 2019, and first it was carried out in 12 affected and also high-risk prefectures. And MAF designated vaccination recommended areas based on the infection status in wild boar, and the governments of those prefectures develop vaccine program to ensure vaccination of all domestic pigs. And the vaccination recommended area have been reviewed and expanded in response to the detection of positive cases in wild boar in new areas. And as of today, a total of prefectures have been designated as vaccination recommended areas. And Japan has only 47 prefectures, so only Hokkaido is not designated as vaccination recommended area. Several measures have been taken to control and eradicate CSF. The biggest challenges is the involvement of wild boars in the spread of this disease. According to epidemiological investigation, it is estimated that the CSF virus, which circulating in Asia, was first introduced into the wild boar population and then spread to domestic pig farms. To identify affected areas in wild boar populations, enhanced surveillance for wild boar carcasses, and as well as surveillance of hunted and captured wild boars are being conducted in affected and neighborhooding at-risk prefectures. In addition, to reduce the number of susceptible wild boars, capturing and hunting have been strengthened in collaboration with local veterinary services and hunting associations and the Ministry of Environment. For wild boars, oral oral bait vaccines have been applied to to the wild boar population since May of 2019, starting in the hottest area of Gifu and Aichi prefectures. These vaccines are mainly distributed by hand in cooperation with local hunting associations, which have the knowledge of wild boar habitats and movement routes. But in areas where hand distribution is difficult, such as steep mountain regions, helicopters are used to distribute bait vaccine from air. And furthermore, as a part of our risk communication efforts, we alert climbers and visitors to the mountain through posters. And posters are provided to each prefecture and displayed at the mountain entrances and other locations. And finally, LSD. The first case of LSD occurred in November 6th of 2024. As you can see, the disease spread rapidly after the first case, and the last case was confirmed in December of 2024. In total, 22 outbreaks were confirmed and 230 cattle were infected. However, thanks to the rapid response measures, the outbreak was limited to only 2 prefectures and was able to contained in 2 months. So, how did the virus enter to Japan? So, since LSD is carried by a blood-sucking arthropods and strains matched to the Asian epidemic strains, the insects, arthropods with virus could be transported from overseas by wind and movement of human activity. At the local level, transmission was primarily driven by vector-borne insect spread between nearby farms. But these arthropod locally transmitted the virus from infected animals to susceptible cattle in the neighborhood holdings. And in addition to the local spread, long distance transmission occurred. Um, this is suspected to occur because of the movement of the cattle. Epidemiological investigations indicated that livestock markets played a role in linking geographically spreaded farms. And another important factor was the presence of subclinical or undetected infections. Some infected cattle may not have shown clear clinical signs at the early stage, and which allows the virus to spread before detection. Once introduced into a farm, the virus spread efficiently within the herd and resulting in a large number of infection. Before the first case in Japan, when the risk of LSD increasing in Japan, MAF established the guidelines for the prevention and control of lumpy skin disease in January 2024. When the outbreak actually occurred, measures were taken in accordance with this guideline. However, at this time, LSD was classified as a notifiable infectious disease in Japan. So as you can see, what measures taken in the farms or farm close to the affected farm, we could only request voluntary measures like refrain from shipment, refrain from movement. We couldn't force the farms to do the control measures. So in the Act on Domestic Animal Infectious Disease Control, what was the difference between notifiable disease and the other disease? In this act, it stipulate notifiable disease, and notifiable disease are classified to two groups: domestic animal infectious disease and notifiable infectious disease. Uh, Domestic animal infectious disease are the priority diseases, and in these diseases, such as HPAI and FMD, are classified to this domestic animal infectious disease. In November, when the LSD first occurred in Japan, LSD was a notifiable infectious disease. And due to this, the compulsory measures could not be taken, so the measures stayed voluntary, just like I said in the previous slide. And on July 2025, the next year of the LSD outbreak, government ordinance was established to permit compulsory measures which made LSD equivalent to domestic animal infectious disease, such as like FMD or HPAI, as a special treat. And on this May, as LSD has been officially reclassified to domestic animal infectious disease under the Act. During LSD control measures, in 2024, it made difficult for us to prevent the the spread of LSD because it was notifiable infectious disease and had no force to make the stamping out or the vaccination a mandate, but so some of the farm did not easily cooperate with vaccines and cullings. Well, I could understand because they have to have the cattle to live. So we didn't have the act to support us. We couldn't get stronger cooperation from the farms. So experience of this, we now have amended the act quickly, and we just prepare for if it happens next, if it happens again. And this will be the slides for which all slides, and I would like to have another discussion time regarding like for questions for these individual diseases or questions or like how does it goes at your countries, and it could be anything, but is there anyone would like to share their experiences? Yes, please go ahead. Augustine-san?
Yeah, thank you, Miyu-san. Very clear. Sorry for me, my English is. I have a question. In the if the outbreak, was vaccination administered to the entire cattle stock of the country or just the Mishakura prefecture, Mishasaki prefecture?
Oh, okay, I would like to clarify, but I'm gonna go ask the interpreter, so just wait a second. 今の質問は、ワクチンが宮崎県だけで行われたか、全国的に行われたかを聞きたいのか聞いてもらってもいいですか？合ってますかね？質問としてっていうので聞いてもらっていいですか？
So, Abu-san, may I confirm your question was whether vaccination was conducted only in Miyazaki or in the whole country? Am I
Yeah,
correct? Yes? はい。
yeah, correct.
その通りです。
はい。この時はですね、ワクチンは宮崎、ちょっと待ってくださいね。そうですね。この時は、ちょっと待ってください。ちょうど地図が。この、赤いところがワクチンを打ったゾーンになっていて、なので、宮崎県のみです。
So, this time, during this FMD outbreak, yes, vaccination was conducted within this zone meaning within this vaccination or red line. This is the vaccination zone. So, in other words, only in Miyazaki Prefecture.
Perfect. Thank you.
ありがとうございます。
Thank you, Agu-san. Does anyone else have questions?
It's not a question, maybe. I don't know if I understand well, but for lumpy skin disease, you said that it was difficult to perform all the control measures, like well done, all the control measures. But I believe this is because maybe you don't have, how to say, compensation fund for, I mean, the cattle to be eliminated, because I think, at least for us, we have compensation for foot and mouth disease. But then if we have avian influenza or other exotic diseases for us, we don't have a compensation for this animal to be eliminated. So it's very difficult to say to the farmers that you need to kill your animals, and then this is only, I mean, it's your job and the only way you have money, and then you will not pay them, and you need to kill but not to pay, you cannot pay. And for us, at least this is our experience in Paraguay in avian influenza in 2023. We have a highly pathogenic avian influenza in backyard. So it was difficult for us because there weren't many animals to be killed, but we didn't have money for farmers to compensate these control measures. So then we managed to have this money from the government, but we didn't have like we weren't prepared for this disease to come. We were lucky that we didn't have a lot of animals to be killed and then to pay the farmers. But I believe that for lumpy skin disease and other diseases you were talking about, you don't have a specific fund or compensation to do this. I mean, I don't know if to eradicate the diseases, but this is the main problem, I think.
Thank you, Patty-san. おっしゃると、すみません、通訳さんお願いします。大西さんお願いします。おっしゃる通りで、実際日本で最初に LSD が起きたときは、法的な強制力がない手法しか取れず、実際に鳥インフルエンザであったり、口蹄疫が起きた時のような、保証が十分に行えないといったところからも、ボランタリーのワクチンであったり、殺処分が進まなかった要因の一つになっています。日本も同じような苦労をしたということをお伝えいただけたらいいです。
So Patti-san, yes, in Japan, yes, we also had this same, how to say, struggle. And so as you said, the first LSD case in Japan. So at that time, this LSD was not the priority, domestic animal infectious disease. So farmers could not receive enough money, enough compensation as they could if they underwent AI or FMD. So that is why voluntary vaccination or voluntary culling did not really, progress. Yeah, so anyway, we went through the same situation as you.
すいません、もう一つあって、で、その LSD が、この、5月に、その疾病として、格上げといいますか、ドメスティックアニマルインフェクシアスディジーズに、リクラシファイされたことで、この 分担金とし、分担金じゃないですね。この、保証も、より法律が後ろになったことで、より、政府としても計画しやすく、そういった、農家のニーズにでもですね、応えられるような、法改正になったと、お願いします。
Right. So since this lumpy skin disease was reclassified this May as domestic animal infectious disease, so this compensation is now more like meeting the needs or responding to the needs of the farmers compared to before.
Okay, thank you very much.
Thank you, パッティさん。Okay, maybe anybody else? How if 質問に関してはまたJICA 経由であってもメールであったりご連絡いただいたら回答できますということをお伝えいただけますか。
So if you have any questions later, then, well, even through JICA, you may ask, well, through JICA, through mail. Everybody okay?
Yes, okay, thank you.
Thank you. Thank you for your response.
So, これ以上出なさそうだったらちょっと早いんですけど、いかがですかね、橋本さん。どうしましょう。
はい。早めに終了していただいても構わないです。
わかりました。So, if there's anyone who wants to share their experience or have questions, it's early, but I think we could close this session. Yes, I think there's nobody reactions. So yes, I think we are good. So just like Oni-san said, any questions if you have afterwards, it is you could just ask JICA to ask the math or like something like that, and we could get answers to you. So please do not hesitate and to ask. So これは終わりの挨拶とかはお願いしてのいいですかね。すいません、ちょっと拙いプレゼンになってしまいました。
So thank you, Dr. Terashima-san, for for your lecture about veterinary services and disease control in Japan from the perspective of Ministry of Agriculture, and how to
Thank you very much. Thank you.
yeah, and how to respond to the outbreaks diseases like FMD and highly pathogenic avian influenza and lumpy skin diseases. So if there's no additional questions or comments, let's close this lecture. Okay, so again, thank you so much for your valuable, informative lecture, Terashima-san. Thank you so much.
Thank you so much. Thank you, everyone.
ありがとうございまし
ありがとう
た。
ございました。すみません。
Thank
そ
you.
したら、このまま退出させていただいて大丈夫ですかね。
はい、大丈夫
はい、
です。
ありがとうございます。
ありがとうございました
失礼します。
桜先生、少し休憩入れましょうか。
そうですね。まあ、なんかそんなに
続けてもらっても大丈夫です。
いや、まあでもじゃあ、10分ぐらいだけ休憩しましょうか。
はい。
はい。So let's have a 10 minutes break from now. So in Japan, from night 5:30. So I don't know your time zones, but anyway, let's start from 40. So 10 minutes later.
Okay.
Okay, thank you. 橋本さん、聞こえますか？
はい、聞こえます。
あ、聞こえます。ちょっとだけさっきの講義で、私がちょっと気づいたというか、ちょっとだけフォローしようかなと思ってるところを、少しだけ5分ぐらいやってもいいですかね？
もちろん、はい、お
あ
願いします。
いいですか？はい。So, uh, as all participants there in front of your PC or laptop?
Yes.
Okay. So now, before starting the how to say inception report issue, please follow up the previous lecture from Ministry of Agriculture, Terashima-san, Veterinary Services and Animal Health Control in Japan. There are some points I want to follow up in that lecture. So let me share. Now, can you see the slide? Actual PowerPoint, no, not PowerPoint, PDF file. Okay. So,
Yes.
okay, thank you so much. Let me remember several points. So, yeah, as I guess Terashima-san explained, in Japan there are 167 local livestock hygiene service centers. These are prefectural institutes. And here in Hokkaido, you are going to visit this black. So I remember that you cannot see the arrows or points. Okay, so let me skip.
We can see the arrow.
You can see. Okay, I see. So you will visit here at Tokachi Livestock Hygiene Service Center while you are in Japan. The point is, as Terashima-san mentioned, the number of officers, animal officers for quarantine is increasing last 7 years, which means Japanese government put a focus on animal disease control, while the budget are decreasing. So one of the practical learning of today's session was you are not allowed to bring meat products in Japan when you can. But don't think that this is the first time, so you won't be punished. But that's not anyway. Don't bring those meat products from your countries, or otherwise, quarantine dog will detect your items. So during the session, I guess Agosti-san raised your question about the biosecurity standards. And I explained that once a year, livestock veterinary officers will be every year visit and check whether the farmer followed these biosecurity standards. And actually, this checking system started after FMD outbreak. It was 2010. So after that, this kind of biosecurity standards came up because before that, we didn't have how to say, checking system of biosecurity standards. So if we have some big impact event after that, we how to say adjust or modify our system. That's a story. And if if the farmers don't follow these biosecurity standards, in this slide, there's a penalty. So the penalty is actually in the Japanese government compensate when there is a I forgot to anyway, for example, highly pathogenic avian influenza or FMD, when the livestock should be culled, the Japanese government compensate the price of the livestock. So for 100% basically, but if farmers don't follow biosecurity standards, the amount of compensation decreases. So in that case, Japanese government compensate only 80% of the livestock price. So that's a penalty system. And one point in terms of FMD vaccination is at first, I guess Terashima-san mentioned about this, but at first, Japan tried to use a stamping out method for the disease control, so without using vaccination. But it turned out to be a fair. It didn't work well, so we couldn't stop the spread of the FMD. So Japanese government decided to use vaccination or emergency vaccination. But the point is, even though the vaccinated cattle are there, even though we used vaccination, but all vaccinated cattle were culled eventually. So the reason why Japanese government used vaccination is because when we use vaccination, so we can reduce the amount of virus for the spread. So because it takes time to cull all the cattle which are suspected to be infected. So, but only vaccination doesn't take so much time. So, as I guess Otsuka-san explained, this led within the red line area, all the cattle are vaccinated in order to reduce the amount of virus. Then all vaccinated cattle were subsequently culled. That's the story of using vaccination. So I guess in your country, FMD vaccinated cattle don't have to be culled, but in Japan, the Japanese government want to keep FMD free status. So all vaccinated cattle were eventually culled. And Hirashima-san also explained about classical swine fever. And yeah, all prefectures except Hokkaido are designated as recommended vaccination areas for domestic pigs. So the reason why Hokkaido is the exception is because in Hokkaido there is no wild boars, which is a contributor of spreading CSF virus. So That's the reason of the exception of Hokkaido, where you are going to visit this month. Yeah, okay, that's all for my follow-up of previous lecture.